I did a presentation on surrogacy. There are two different types of surrogacy: traditional surrogacy and gestational surrogacy. Traditional is where the father's sperm is artificially inseminated in the surrogate, meaning that the surrogate's egg is used. Gestational surrogacy has the attendant parents use in vitro fertilization, and the egg gets implanted into the surrogate's uterus. The occurrence is it's actually gone up quite a bit, and about 53.4% of these infants were twins, triplets, or a higher order of multiples due to the fact that multiple embryos are implanted per cycle to increase the chances of pregnancy. Occurrence of the assisted reproductive technology nationally accounted for 1.8% of all infants born in the United States. Arkansas falls pretty close to the bottom with 0.6% of the infants born. Socioeconomic considerations. This is pretty expensive considering the surrogate process is a long and risky and expensive one. In states like California, where in their high demand, they may be more expensive as well. Here is a list of some of the expenses that have to do with, what the intended parents are going to pay for. Ethical dilemmas. It's often a concern that surrogates will get attached to the baby after it's born and change their mind. And here's a lot of questions as far as ethical dilemmas on things that are kind of up in the air in a grayscale. These kinds of dilemmas are costly to both the parties involved. That's why it's extremely important to educate yourself about your state's laws and requirements, as well as get an attorney involved in the surrogacy process. Health risks related to surrogacy. There's the usual health risks for pregnancy, of course, and each surrogate is going to be different. Most surrogates have already had a pregnancy before, and so they can kind of base it off that. But it's also increased risk related to multifetal pregnancy, since those odds go way up whenever they're using the IVF process. It's also common that they'll have to use hormone injections in their process, since their body is not adjusting for itself to get pregnant. It's kind of forcing it into pregnancy. They have to have some of those injections to help. How nurses can help. Just closely monitoring the surrogate. As previously mentioned, surrogates can often carry the multiples. The intended parents, it would help to educate them with the signs and symptoms that they should expect. Since it's not their own physical pregnancy, they may be anxious about some of the small events that are happening because they have invested so much in it. And it's important to check the surrogate's knowledge on what she should expect. As stated, most surrogates have been pregnant before, and a lot of them are with agencies, and so they have been educated about it. They have done it before, or they had to learn about it before doing this process. And then encouraging them to work together to form their birth plans to reduce anxiety and make the process as smooth as possible. Here are some of the support and resources. Kay McLeod is actually an attorney in Central Arkansas that works with surrogacy and all of this listed specialties. There are also some grants specifically for the LGBTQ community having children through surrogacy. There's an example listed, the menhavingbabies.org, that you can apply for that. The Agency for Surrogacy in the Southern region of the U.S. is based out of Georgia. They're the Southern Surrogacy. So they're the closest one that deals with the Southern region. And there are the sources that I used.